Now next what we have is about the chronic inflammation. Okay, now in chronic inflammation, first thing you need to see is about the types of cells. Okay, what are the types of cells that are available? We have the lymphocytes, then we have the macrophages, and then we have the plasma cells. Okay, these are the types of cells available. Now if I ask you that what is the hallmark of this chronic inflammation? So the hallmark of this process is the destruction followed by the repair. First there is destruction of the cell, which is followed by its repair. Okay, now let's talk about the macrophages, because macrophages are the most important ones. Okay, macrophages are the most important ones. So we will talk about the macrophages. Now macrophages are broadly classified into the two, M1 and M2. Okay, M1 is classically active and M2 is alternatively activated. Okay, M1 releases the interleukin 1 and 6. They are pro-inflammatory. And whereas on the other hand, M2 releases interleukin 10 and TGF-beta. Okay, they are the anti-inflammatory. They are the anti-inflammatory. Next thing that you need to study is about the macrophages in every organ. Okay, macrophages in every organ. There is separate name which is given, so we will see. Like for brain, we have the microglia. For lungs, you have the dust cells. For liver, you have the Kupffer cells, and this you know. Okay, in liver you have the Kupffer cell. For kidney, you have the mesangial cells. For spleen, you have the littoral cells. Okay, so mainly what you need to remember is just remember about the brain, the liver and the kidney. Okay, just remember this much. Rest information is not that much important. Now next thing that I will be talking about is the granulomatous inflammation. What is granulomatous inflammation? It is basically a subtype of chronic inflammation. Okay, it is basically a subtype of chronic inflammation. If I talk about the components, then see this figure, you are able to appreciate the components. What are the components that we have? We have the epithelioid cells, we have the lymphatic collar, and we have the epithelioid cells. Okay, so the components are in the center. See, in the center you are able to appreciate this whole center, you are able to appreciate a caseous necrosis. And I have told you earlier what is caseous necrosis means. Caseous necrosis, C for C. Caseous necrosis means a cheese-like necrosis. Okay. And then you have other thing is the macrophages cells that are present in the center. Okay. Lymphocytic collar, that has T helper 1 cells and interleukin Y and the granuloma. Okay. So if I ask you what is the most important, there's a question. Okay. I'm asking you a question. The question is, what is the most important hallmark of chronic inflammation? So the most important hallmark of chronic inflammation is your macrophages cells. Okay. Most important hallmarks and most important cells of chronic inflammation is your macrophages, and destruction is followed by the repair in this process. Now, let's learn about the types of giant cells that we have. The first one that we have is the Langerhans giant cells. Langerhans giant cells are basically the horseshoe arrangement of nuclei. Okay, it is the horseshoe arrangement. See, horseshoe arrangement of nuclei, and it is seen in the tuberculosis. The Langerhans cells are basically your antigen presenting cells, and they are mainly the dendritic cells which are found in the skin. Okay. Next thing you have is the Taunton giant cells. What are they? They are basically a wreath-like arrangement. There is a wreath-like arrangement which is there. Like if I draw, then this is a wreath-like pattern which is there. This is a wreath-like pattern which is there. Okay. Now what is happening in this type of giant cells is there is a vacuolated cytoplasm which contains fat, and in certain conditions like in xanthomas, which is a lipid disorder, this type of giant cells may be found. So what happened in this kind of disorder is the eyelids of the patient, you are able to see that some amount of lipid is deposited in the eyelids of the patient. Okay, this is xanthoma, and you will learn about this in your biochemistry lectures. Okay, now the stains that we use for lipid, what is the stain that we use for lipid? I have told you that is your oil red O stain. Okay, that is your oil red O stain. If you are not able to remember, we will just make a mnemonic that O. Remember, O for a obese person, and obese person has a lot of cholesterol, and cholesterol is related to your lipid. So for lipid, we use the oil red O stain. Okay. Next thing that we have is the foreign body giant cells. Now for the foreign body giant cells, there is a haphazard arrangement. Okay, it is seen in the foreign bodies like in the suture and in the talcum powder. Okay, it is visualized with polarizing microscope. Okay. Next thing that we have is the Warthin giant cells. Now, what is Warthin giant cells? Warthin giant cells are basically your intranuclear inclusions. They are basically your intranuclear inclusions, and they are seen with the measles virus, Okay. Now, let's talk about the measles virus. What is happening in the measles virus? In measles virus, you have the 3 C's. What are the 3 C's that you have? That is, you have the cough, you have the coryza, and you have the conjunctivitis. And there is a special spot that is present, that is called as the 𝗲𝗵𝗵 spot, that is found in the buccal mucosa, and it also presents with rash. Okay, remember the 𝗲𝗵𝗵 spot very well. Next we have is the Reed-Sternberg cells. See this figure, you are able to appreciate that something is similar to a owl-like pattern. So, it is the owl eye appearance. There is a owl eye appearance, and there is Hodgkin's lymphoma. Okay, and there is Hodgkin's lymphoma. Similarly, the owl eye appearance is also seen with the 𝗖𝗵𝗵𝗴𝗿. Okay, it is also seen with your 𝗖𝗵𝗵𝗴𝗿, Reed-Sternberg cells. Next thing that we have is the HSV. Now, what is HSV? HSV is basically multinucleation. It is the multinucleation, and it is the molding of nuclei. There is margination of nucleus. See, I'll also explain you. Look at this figure. In this figure, you are able to appreciate that the margins are more dark. Margins are more dark. Okay, this is about the HSV. Now we have talked about the types of giant cells. Now let's move on to the causes of granulomas. Okay, for the causes of granulomas, they are basically divided into 2 types. First one is your infectious, and second one is your non-infectious. Now, what happens in the infectious one? First, talk about the infectious one. In infectious one, you first have your tuberculosis. In tuberculosis, you are able to see a caseating granuloma. Okay. Then you have the leprosy. In leprosy, you are able to see, leprosy also you are able to see a infectious granuloma, mainly in your tuberculoid leprosy. Next thing you have is the syphilis. Okay. Next you have is the stellate granulomas. Stellate granulomas. Now what happens in the stellate granulomas? See this figure. These type of granulomas, like a star pattern, is your stellate granuloma. Okay, this is your stellate granuloma. Now, in stellate granuloma, what we need to understand is it is found in two conditions. First one is your cat scratch disease, which is caused by your Bartonella Hensley. Okay, and second one is your LSV. What is LSV? LSV is basically your lymphoma granuloma verenum caused by the 𝗵𝗵𝗵𝗵. It is basically a sexually transmitted disease. Okay, you will learn more about this in your dermatology lectures. Next thing that you have is your about the donut granuloma. Okay, donut granuloma. You all know how a donut looks like, right? Like this, something like this, the donut looks like. Although my drawing is not that good, but this is how the donut looks like. See this figure also. In this figure, this is a donut like pattern that you have, right? Next thing. Next, you all to understand is donut granulomas are basically seen in your Q fever, okay, and in the allopurinol disorders if there is excess of allopurinol. Okay. Next thing that you have is about the duck granuloma. Okay, it does not look like a duck, but it's just that its name is duck granuloma, found in the cerebral malaria. And cerebral malaria is associated with the Plasmodium falciparum. I'm just sorry, I just had a slip of tongue. It is associated with your Plasmodium falciparum. Okay. See, what is happening is if you will take a blood smear now, then in the blood smear, you are able to appreciate some small granules that are called your duck granules. Okay. Next thing that we have is about the non-infectious one. For the non-infectious one, what you need to understand is in the non-infectious one, it is associated with vasculitis. What is vasculitis? Vasculitis means there is inflammation in the vessels, and we will learn more about this in the CVS, okay, in the CVS system. So, vasculitis, like your giant cell arthritis. Giant cell arthritis mainly involves your large vessel arthritis, okay, and second one is your Crohn's disease. Okay, now tell me, Crohn's disease is a type of inflammatory bowel disease, right? It is a type of your inflammatory bowel disease. Tell me, skip lesions are found in either the ulcerative colitis or the Crohn's disease. Tell me, in which of the following condition the skip lesions are found? You have to tell me this, okay? Next thing that I want you all to understand is small difference between regeneration and repair. What is regeneration means? Regeneration means there will be no scarring. Okay, all the thing will be new, so there will be no scarring. Example if I want to give you is about the liver transplant. And here in the repair, there is injury or lost cells are basically repaired by the scar. So scar is present in the repair. Now this was all about the inflammation part, okay, and the granules part. Next you have is the very important topic, and guys, trust me, this will be your long answer type question in your university exam. So you have to be very thorough with it, and you have to be very prepared about it, right? So let's start with the wound healing. Wound healing, the types of wound healing you have is, first one, the primary intention. Second one will be the secondary intention. What happens in the primary intention? Primary intention means there is some clean wound. Okay. Example is your surgical incision. Second one is your secondary intention. Now, primary was clean, so secondary one has to be a dirty one. So, the example can be when anyone met with an road traffic accident, RTA. Okay. It is a dirty type of wound with irregular margins. And tell me, in the primary intentions, margins would be the regular one because it is a planned incisions, right? So they know what and where to cut and how much to cut. So it is the margins are regular. Now, next that we have is about the events. Okay. Day wise, the events are divided. Like on day 0, that is the beginning of the infection, the beginning of the wound healing, what we have is the platelets and fibrins. What they form? They form the blood clot. They form the blood clot. On day 1, what you have? On day 1, you have the blood clot plus your neutrophils. Second, on day 2, what you have? On day 2, you have your blood clots, then your neutrophils, and then your a thin epithelial layer. And most of us have done this in our childhood when we used to get some kind of infection there, and that process is trying to heal by itself. What we used to do? We used to scratch that, right? So you don't have to do that. On the third day, what you have? The process of chronic inflammation starts. Okay, so if there will be an MCQ in your university exam that the chronic inflammation starts at, so you will mark the answer as at day 3. Next that you have is the macrophages also come into picture, and the granulation of tissue start. Granulation of tissue formation starts. Now, on day 6, what you have? On day 6, you have the maximum granulation. And the collagen bridging. Next thing, on day 21, mostly the process ends by week 3 or day 21. Okay, day 21 or week 3. So there is maximum collagen that is there. Which type of collagen? You mainly have type 1 collagen. And type 2 collagen is seen where? See, type 1 collagen, how you write 1 is ONE. So 1 is related to your bones. And type 2, how you write 2? It is related to your cartilage. It is related to your cartilage. Okay. So if someone asks you how you will define the process of wound healing, first you will write about the type. You have two types, primary intention and secondary intention. Then you will describe about the days and the events. And trust me guys, this table will be sufficient if it is asked in your short answer type questions. Okay. Now next thing that you have is about the granulation tissue. Next thing that we will talk about is your granulation tissue. Now what happens in the granulation tissue? Granulation tissue are basically the hallmark of repair. And they basically comprises of the proliferating blood vessel, the inflammatory cells, and the fibroblast. And fibroblast guys helps in your scar formation. Fibroblast helps in the scar formation. Okay. Now we have certain factors that delays the wound healing and factors that promote the wound healing. Okay. So we will give a heading of factors of wound healing. Okay. We have mainly two factors. First one that promote wound healing. And second one is that delay wound healing. Now let's understand them. Now guys, before starting, you tell me what you think, that which factors basically delay the process of wound healing. What are the factors that delay the process of wound healing? Think about it. Okay, so what is the vitamin that delays? If there is a deficiency of that vitamin, so the process of wound healing will be delayed. It is the vitamin C deficiency. Okay, and vitamin C is responsible for your scurvy. It is responsible for scurvy. Okay, so it is very essential to eat citrus fruits. Okay, next thing is the infections. Obviously, if there is any kind of infections, then it will promote the delay in the wound healing. Next thing that you have, if a person is a diabetic person, if there is diabetes. Second thing, if the person is a malnourished person. And last, if there is a zinc deficiency. And you will learn more about this in your biochemistry lectures, that what happens when there is a zinc deficiency. I can just tell you there are certain skin changes that you are able to see when a person is having the skin deficiency. Okay. Next thing, let's talk about what are the factors that promote your wound healing. So, first one is the vitamin C, collagen formation. Second one is zinc, right? What zinc do is basically the remodeling, and it breaks the scar. If we are talking about the scars, let's talk about the very special two types of scar that we have. First one that we have is the keloid. Now what is keloid means? Keloid is basically a type of scar which is basically caused by a trauma. Okay, and it crosses the margin. Treatment, if I talk about, the treatment is the injection of steroids. Okay, this figure, see, chest is the most common site of keloid formation. Next thing that you have is the hypertrophic scar. Hypertrophic scar is basically formed due to the trauma. What happens in the hypertrophic scar? The scar is basically limited to wound margins. Okay, I'll draw the figure. Like suppose this is your skin. Okay, and there is certain trauma that has happened. So the scar will be limited to this area only. This is your skin and this is your scar, the hypertrophic. Okay guys, this was all about the keloid and hypertrophic scar. And more or less, as far as I know, this will be asked in your MCQs or a 2-mark questions. Okay, because there is nothing much in it. Next thing, I have a question for you guys. Tell me the answer. The question is, what is the most important cells of granuloma? Okay, and your options are giant cells, macrophages, lymphocytes, or epithelioid cells. The answer to this is the epithelioid cells. The epithelioid cells. Okay, this was all about the chronic inflammation. We have talked about the wound healing as well. We have talked about the keloid and the hypertrophic scars. Okay, and we have also solved a MCQ. Next thing that we will be talking about is your genetics. In genetics, we will first talk about the non-Mendelian disorder, then we will talk about the Mendelian disorder. In non-Mendelian disorders, you basically have the 4 types. That is your first one, mitochondrial inheritance. Second one is your trinucleotide repeat disorder. Third one, genomic imprinting. And fourth one is your gonadal Mendelian disorder. Okay, now first let's talk about the mitochondrial inheritance. First we will talk about is the mitochondrial inheritance. Now what happens in the mitochondrial inheritance? Remember this thing, that mitochondrial inheritance, M for M. Mitochondrial means the disease is transmitted from mother to all the offspring. Okay, it is 100% maternal disorder. Now, if I talk about the examples that we have, the first one is the MELAS, that is mitochondrial encephalopathy, lactic acidosis, and stroke-like episode. It is the most common mitochondrial inheritance. Second thing that we have is this is the first example. Second example that we have is the Leber's hereditary optic neuropathy. Okay. Next example that we have is the chronic progressive external ophthalmoplegia. These are the certain examples that we have in the mitochondrial inheritance. Okay. Next, what I want you all to understand is about the trinucleotide repeat disorder. Trinucleotide repeat disorder. Now, as the terminologies only suggest, trinucleotide means something related to the number 3 is there. Okay, there are 3 alphabets which you need to remember in each and every disorders. Okay, it is basically a repetition of the trinucleotide. And the examples that you have is either can be in the introns. Introns are basically your non-coding, or this disorder can be in your exons. Exons are the coding ones. Okay. So in the introns, what are the 3 examples you have? First you have is the Fragile X syndrome. Don't worry, we will study them in details as well. Fragile X syndrome is the CGG trinucleotide disorder. Then you have the myotonic dystrophy. Myotonic dystrophy. That is your CTG. Remember, myotonic T and T. So there is a T. Next that you have is the Friedreich ataxia, and it is GAA trinucleotide repeat disorder. And in the exons, that is the coding one, you have your Huntington's disease, you have your Huntington disease. Second you have is the spinocerebellar ataxia. And the repeat disorder that you have is the CAG. So you can remember with the mnemonic of hunting in a cage. Hunting in a cage. Okay. Next, let's understand them in details. First thing first that you have is your Fragile X syndrome. In the Fragile X syndrome, it is basically a X related disorder, and the XLR, that is X-linked recessive disorder. It is a trinucleotide disorders. Males are most commonly affected than the females, and the repeat disorder that we have is the CGG repeat. Okay, and the repeat is CGG repeat. If I talk about what are the clinical features that are seen, the clinical features that you will be able to see, first one is the macroorchidism. Macroorchidism means increase in the testicular size. Next you have is the mental retardation. And how we assess that if a person is having mental retardation or not is with the help of the IQ. So IQ of these patients are basically 20 to 60 out of 100. Next you have is the large mandible, large ears, and a long face. Okay, so remember, you can just remember one thing, that everything here is large. Everything is large in this. Next thing that you have is the diagnosis. How you diagnose this case? The diagnosis is basically on the PCR with the help of southern blotting. You have three types of blotting techniques. What are they? Southern blotting, northern blotting, and the western blotting. Okay. So, right. This was all about the your Fragile X syndrome. Next that you have is your myotonic dystrophy. Next you have is about the myotonic dystrophy, and myotonic dystrophy is basically a CTG repeat. Chromosome that is affected is your chromosome 19, that is affected in your myotonic dystrophy. If I talk about the clinical features, what are the clinical features that are present? The clinical features are, first thing is the patient is not able to terminate the grip. So if you try to shake hands with that person, the person will not at all leave your hand. Okay. So you should always select a myotonic person only in your life. Jokes apart. Okay. So they cannot terminate the grip. Next thing is, in the eyes you will be able to see a Christmas tree cataract. Okay, you will learn more about the cataracts in your ophthalmology. In myotonic dystrophy, remember, you are able to see a Christmas tree cataract. See, like this is your eyes, and you are able to see not a proper Christmas tree will form, but something like this will form a Christmas tree cataract. Next thing that you have is the what? Other clinical features is your testicular atrophy will be there. Testicular atrophy will be there. Okay. Now let's now talk about the genomic imprinting. What does genomic imprinting means? What does genomic imprinting means? Genomic imprinting means gene slicing. Okay, genomic imprinting means gene slicing, and it is a normal process. Okay, we have some syndromes that you need to remember. First one is your Prader-Willi syndrome. Prader-Willi syndrome, and second one is your Angelman syndrome. So remember, P for P. In Prader-Willi, the father, that is your papa, will be affected. The chromosome of papa will delete. Okay. In Prader-Willi, papa, that is the paternal chromosome, is deleted, and it is the chromosome number 15 and the SNORP gene. See, here also P is coming. So it is the Prader-Willi. Next you have is the Angelman syndrome. So angel, remember, who is the angel in your life? Your mamas. Okay, so mamas are the angel. So maternal chromosome is deleted. Okay, and you have the chromosome 15 UBE3A gene. In the last A is coming. A means Angelman. Okay. Now, if I talk about what are the clinical features that we have. So, let's learn about the clinical features. In the Prader-Willi, you will have the mental retardation. And there will be short stature. The person will be a obese person. So obesity will be there. And in the Angelman, you have the happy puppets. What is happy puppets means? Happy puppets means they continuously keeps on laughing. Okay. So you have the happy puppets. There will be seizures, ataxia, mental retardation, and inappropriate laughter. This means they are the happy puppets. Okay. This was all about your non-Mendelian disorders. We have seen about the what? We have seen about the mitochondrial inheritance. We have seen about the trinucleotide repeat disorders. And we have seen about the genomic imprinting. Now next move on to the chromosomal abnormalities. That is the chromosomal disorders. Okay, the chromosomal disorders. Now what we will learn in the chromosomal disorders, we will first learn about how it works and then we will do the pedigree analysis. Okay. Next, I'll show you how you have to do the pedigree analysis of each and every disorder. Okay. Now see, let me just draw a chromosome for you all firstly. Suppose this is your chromosome. Okay, suppose. Where is my chromosome? Okay, it has gone. Let me just draw it again. Suppose, now please don't go. I will not be able to draw it again. This is your chromosomes and in the center you have the centromere. In the center you have the centromere. In the ends, what you have? You have your telomerase. Okay. And here you have the P and here you have the Q. P is your short arm and Q is your long arm. Okay. And here also you have the telomeres. These are about the parts of chromosomes that you have. Okay. Now let me just tell you about the chromosomal disorders. Okay. First one, we have the structural disorders. First we will talk about is the structural disorder. Structural disorder means something related to the structure of the chromosome. Something is happening with the structure of the chromosome. First one is about the deletion. Okay. Deletion or loss of chromosome. What is happening here? The whole or a small part of chromosome is being deleted. Okay. And example is your VHL syndrome. What is VHL syndrome? I have told you earlier. What is VHL syndrome? Deletion in the chromosome number 3. What it is? It is your von Hippel-Lindau disorder, deletion in the 3p chromosome. Okay. So remember VHL, how many letters it has? It has 3 letters. So it means deletion in the chromosome number 3. Okay, this much is clear. Next example that I want to give you is the Cry-do-chat syndrome. Cry-do-chat syndrome. What happens here? Here is the deletion of 5p chromosome. Okay, here there is deletion of 5p chromosome. Next that we will talk about is about the inversion. What is happening in the inversion? In inversion of a chromosome, there is 180-degree flip of chromosome. Okay, there is 180-degree flip of the chromosomes. Now, what is happening is around the centromere, there is pericentric inversion. If I talk about the example, then you have it in the acute myeloid leukemia, M4. Inversion is inversion 16. Okay, this was about the inversion. Next, what you have? Next that you have is about the translocation. Now, what is happening in the translocation? In translocation, there is basically a balanced reciprocal translocation. It is mainly found in your chromosome number 9, that is the ABL gene, and the chromosome 22, that is the BCR gene. Okay, translocation 9 and 22. Next thing that you have is about the Robertsonian translocation. Robertsonian translocation. What is Robertsonian translocation? Robertsonian translocation means the echocentric chromosome is translocated. Example is your T14, 22, 21, sorry, and T21 and 22. Okay, if I talk about the mechanism of action of it, so what is happening here is there is a break in the short arm in one chromosome and in the long arm of another chromosome. So I'll just draw figure again to explain you all. These are your two chromosomes. In first one, there will be a defect, short arm, and in the second one, there will be a defect in the long arm. Okay, and the example very famous that you need to remember is the Down's syndrome. Tell me guys, Down syndrome is due to which chromosomes? You have to tell me this. Tell me about Down syndromes and Edwards syndrome and Patau syndrome. Okay, it is 13, 18 and 21, and now you have to tell me which chromosomes are related to which type of syndromes. Okay, is it related to Down syndrome, Edwards syndrome or Patau syndrome? Next thing that you have is about the ring chromosome. Ring chromosome. In the rings chromosome, what happens? The damaged ends of the chromosomes sticks like a ring. Again, I am drawing a figure. Let's suppose that these are the damaged parts. So what they will do? They will stick to each other like a ring. They will stick to each other forming a ring. So that is why it is called as a ring chromosome. Okay, what is the example? In example, you have the Turner syndrome, and Turner syndrome is a 46XO. Okay, syndrome. Next thing that I want you all to tell is about the isochromosome. Guys, tell me one thing. Turner syndrome is 46XO or 45XO? Okay, it is 46XR, that is X, or 45X. Which is more better to write? Tell me that. Okay, next you have is the isochromosomes. Isochromosomes means the chromosomes with two similar arms. Okay, similar arms. Now, the most common isochromosome is associated with your testicular cancer. Okay, next thing that we will talk about is your nuclear disorders. Okay, numerical disorders. What is numerical disorders? Numerical disorders mainly means the aneuploidy. It can be either 2n plus 1 or 2n minus 1. What is n? N means the multiples of n. Okay, multiples of n. It can be either diploid, it can be either triploid. Okay, next thing that you have is about the Down syndrome. Down syndrome. So what is Down syndrome? See, remember, Down syndrome can be asked as a short note question. So Down syndrome is basically a trisomy 21. Okay, what happens here is pathogenesis. What happens here is it is a meiotic non-disjunctional of chromosome 21, and it is associated with your Robertsonian translocation. Okay, if I talk about the clinical features, then in the clinical features, the first thing that you need to remember, it is the most common cause of mental retardation. It is the most common cause of mental retardation. Next thing that you have, you are able to see the mongoloid faces. Okay, mongoloid faces, and there is continuous open mouth with micrognathia. What is micrognathia means? Micrognathia means small chin. Okay, next that you have is the simian creases. They are the single line crease that is present. Now look at your palm. You have so many multiple creases like 1, 2 and 3, right? You have so many multiple creases. But if a person is suffering from Down syndrome, if I draw the hands, there will be only a single crease that will be present. There will be a single crease that will be present. This we have talked about the clinical features. Now let's talk about the complications what are the complications that we have? Most common is leukemia. See, normally you all know what is leukemia. Leukemia means blood cancer, and we will study about this in the hematology chapter about the leukemia. Okay, so the most common complication is the leukemia. Second thing you have is the complications of your central nervous system. That is, there is the Alzheimer's disease in 30s. If a person has attained its 30s or in his or her 30s, then there is Alzheimer's disease. Okay, in the CVS, if I talk, there is endocardial cushion defect. In the GIT, you have the duodenal atresia. D for Downs and D for duodenal atresia. D for Downs and D for duodenal atresia. Now, what are the investigations that you can do? Investigations, see, it can be diagnosed antenatally. What is antenatally? Antenatally means it can be diagnosed during the pregnancy as well, during the first trimester of the pregnancy. So, or the first, second, third, any. Okay. First, you have the USG. In the USG, you will be able to see the knuckle translucency is increased. Okay, the knuckle translucency is increased. And when you do the blood investigations during the pregnancy only, then in the first trimester you will see that there is increased beta HCG levels and decrease in the pregnancy associated plasma protein A. Okay, next thing, if you go in the second trimester, you will do a test called as the triple marker test. In the triple marker test, what you will be able to see, there is increased beta HCG and decrease in the alpha beta protein. Then you will do the quadruple test. See, you will learn about this in more details in your obstetric and gynecology. I'm just giving you that part which is important right now. Okay. So in the quadruple test, you have the triple marker plus inhibin. Okay, you have the triple marker and the inhibin. This was all about the Down syndrome. Okay, and you can also continue karyotyping. Karyotyping is confirmatory. Next thing that we will understand is about the other type of disorders that you have is the Patau and the Edward. Okay, so first thing first, we will study about the, okay, let's study about them together only. We will study them together. Patau syndrome. Next you have is the Edward syndrome. Okay, Patau syndrome and Edward syndrome are the two types of chromosomal disorder that you need to understand. So Patau syndrome is basically trisomy 13. You can remember this, the age of adolescent is from 13 years, right? So in 13 years we get affected, we get attracted to another gender, right? So in at the age of 13 years we patau the opposite gender. So it is Patau syndrome, that is trisomy 13. And Edward syndrome is trisomy 18. You can remember this with when we are 18 years of age, we are able to give our votes. We are able to participate in the election process. So E for E, when we are 18, we are able to give votes, and that is the Edward syndrome. Okay. So the origin of both of them are maternal origin only. Okay. That is transferred from the maternal origin, transferred from the mother. Okay. If I talk about the heart defect, that is VSD is more than PDA. Okay. And there is rocker bottom feet. What is rocker bottom feet? Rocker bottom feet basically means feet like this that we are able to see in cartoons, right? It is like a chair. You have seen that chair in cartoons as well. A cartoon character sits on that chair and that just keeps on moving forward, then backward, forward, and then backward. So these are basically your rocker bottom foots. Okay. Next thing that we will be talking about is the Klinefelter syndrome. Okay. Klinefelter syndrome. What is in the Klinefelter syndrome that we have? For the Klinefelter syndrome, it is basically 47XXY, and maternal is more commonly affected than your paternal chromosomes. Okay. If I talk about the clinical features, the clinical features that you have is the mental retardation, then you have the decreased in the sexual character, and you have the hypogonadism. The complications, if I talk about the complications, most common is cancers. Okay, that is the male breast cancer. There is decreased in the testosterone levels, and the LH and FSH are increased. Okay, this was all about the Klinefelter syndrome. Next that we have is the Turner syndrome. In the Turner syndrome, as I have mentioned above as well, it is 45XO deletion or 46XRX, that is the ring chromosome deletion. Both the ways you can write Turner syndrome. Okay, so here what happens is there is a normal IQ. Clinical features are, first one, there will be webbing of neck, and it is the most classical and significant finding of the Turner syndrome. Remember this, it can be asked in your MCQs in your university exams. Okay, next that you have is the shortened fourth metacarpal. And there is poor breast development and cystic hygroma. You will learn about cystic hygroma in your surgery lectures. Okay. Next thing, it is the most common cause of primary amenorrhea. What is primary amenorrhea? You have two types of amenorrhea, primary amenorrhea and secondary amenorrhea, and you will learn about both of them in your obstetrics and gynecology in more details. Okay. Now lastly that I want to talk about is the Noonan syndrome. Noonan syndrome is similar to Down syndrome, that's why we need to talk about this. What is the main difference? It is the male counterpart of Turner. Turner syndrome was mainly happening in the females. Noonan is the male counterpart of your Turner syndrome. What happens is here there is chromosome 12 problems associated with the PTPN gene, and the IQ here is low. Okay, so we have talked about the Noonan syndrome, the Turner syndrome as well. Now next move on to the diagnosis of genetic disorders. Okay,